So good evening. I am Dr. Sandeep Govil. So today we enjoy the YouTube class for last minute revision in psychiatry for the NEET, for the INI-CET. So good evening. So that is what we learned today. Just a brief about the INI-CET, the new pattern, because the contention is very simple that whatever the exam it may be, if we know the basics, if we know the real theory, then probably nothing will be amiss for us. So now welcome all of you who have joined. So a brief discussion about us, before briefing about us. So I am Dr. Sandeep Govil with a 15 years teaching of PG exams, and I have been taught at many platforms. And at the Unacademy Plus subscription, we have a value for the money from the daily live classes, structured courses, live test and quizzes, unlimited access to the material. So recorded courses are available, unlimited. Every month the course will be completed. Every subject will be taken in a fast manner and slow manner both. And this is the unique of the Unacademy platform, the iconic subscription. So get the best of the Unacademy and best of the prep ladder at the one platform called iconic subscription of Unacademy, where we have a live classes and batch courses of the Unacademy and the video lectures and the question bank of the prep ladder. So here we have the live test and quizzes, and there we have a rapid revision courses. Also there is a T20 going on. So we know it's a season of T20. So we have T20 for NEET PG 2022 happening at 9 p.m. daily, and free live test on the Unacademy NEET PG 2021. So that is happening at 8 p.m. So we are having for the 21 we have I should come here actually obstructing the view of 21. So basically 8 p.m. we have the NEET PG T20 championship, basically a live test for the sab chale gaye bacche. So we otherwise have a ritual of YouTube classes happening at the 10:30 p.m. on Tuesday, and every Thursday, every Saturday, Sunday we can have a free class. For today we also have a free class of the dissociative disorder, the grief, the eating disorder, the PTSD, the adjustment disorder. Pranam Dr. Sahab. So welcome Dr. Sanjay Nain. So today also we have the special class. You could enjoy that. The various type of dissociative disorder, its status in the DSM-5 and ICD-11, and grief and all that. So that's a ritual we follow. So we start the class with the revision sort of a thing of a MCQ in the INI-CET pattern, because the Institute of National Importance, they need students who are just really know the subject. Anyway, even the MCQ doesn't make anybody to let anybody by chance, but in the INI-CET they make sure that the student who qualify really know the subject very well. So the first MCQ has been asked. Flight of ideas are seen in all except. So it is seen in the all of the following, if at all we have to say. Exception will be the depression and the delirium. We know the lesion of the hippocampus. We know flight of ideas. Welcome, Dr. Aparna. So we know the flight of idea is a hallmark of the mania. The related question here is, the prolixity, which is nothing but the milder variety of flight of ideas found in hypomania. So B and D also we don't have, because in D there is a disorientation. So as per literature, delirium we don't find, though everybody say B. But if at all there are possibility of two choices, we should also say delirium, because delirium is a state of disorientation. There is association by chance is also not possible, because we know flight of idea is the two sentences have a superficial association. So I don't think it is to be said in delirium, but B and E should be the answer. So that's what we learn. Lesions of the hypothalamus, not hippocampus, it's a hypothalamus. So this is a very, very loving MCQ nowadays. Which of this following is included in the 5-factor theory of the traits of the personality? Simply we learn it's a ocean. So first time the normal traits of personality has been asked in the examination. So we have the extraversion, agreeableness, neuroticism and openness to experience. And we have the conscientiousness. So welcome you all, thank you all for joining us. So there is no dominance mentioned, there is no creativity mentioned in the 5-factor traits of the personality. Okay. Done. Ocean is a code to remember. Openness to experience, conscientiousness, extraversion, agreeableness and the neuroticism. So that is what we have. Whether the person is inventive versus curious versus consistent and cautious. Conscientiousness talks about the efficient, organized person versus the extravagant, careless person. And agreeableness is a friendly, compassionate versus challenging and callous. Neuroticism is the people who are quite sensitive versus nervous versus resilient versus confident. Okay. So these were the 5-factor theory of the personality. We know this is normal personality traits, and we have a simple in personality disorder. We know there is a clusters of personality. Cluster A, cluster B and cluster C. Cluster A is the odd and eccentric. B is the attention seeking. C is the anxious. Good evening, Dr. Khan. So odd and eccentric, attention seeking and the anxious. You remember in M.B.B.S, this time they ask you what all we have in cluster A. So we know simple lollipop MCQ asked many times from psychiatry in AIMS, in PGI, this time in M.B.B.S, So it's always a loving question. So we have paranoid, schizoid and schizotypal PD here. In attention seeking variety, we have the narcissistic PD, we have the antisocial PD, we have the histrionic PD, we have the borderline PD. In anxious, we have the anxious avoidant PD. We have a anxious avoidant PD. We have a dependent PD. We have a anancastic PD. So that is the basic framework we must remember in a personality disorder. So other than the personality trait has been first time been asked in the PGI Chandigarh exam, asked in Nimans and Jipmer at least once earlier, but we must not forget the personality disorder. So that completes the simple questionnaire. In the aims they ask you histrionic PD is cluster B, anxious, shy, avoidant PD is cluster C. Simple lollipop MCQ come from this simple learning of framework of the psychiatry. Now, what is the drug of choice of the akathisia? Akathisia, we all know it's a most common side effect of typical antipsychotic. It's a most common side effect of the typical antipsychotic. बताइए डॉक्टर साहब, which of the following is the drug of choice for akathisia? So most common side effect is the akathisia, and drug of choice of this is of akathisia is very good, Dr. Kishore. It is beta blocker propranolol. Be very careful. The most common side effect of the typical antipsychotic is akathisia, but the earliest side effect is the dystonia. Earliest side effect is the dystonia. You remember this, Nimans, they talk about the dantrolene. क्यों लगा रहे डॉक्टर साहब? Dantrol is a drug used for the NMS. So in the INI, they always, in the any exam, they are very, very particular about the side effect of the typical and the atypical antipsychotic. So dantrolene is a drug of choice for the neuroleptic malignant syndrome. But please mind the trick here. The most common side effect is the akathisia, but the earliest side effect is the dystonia. ठीक है डॉक्टर साहब? In Nimans, they ask you dystonia happens because of. Now, which are the following features of a depression? Which of the following is a feature of the depression? I would say perception is a hallucination. We must know disorders of perception are the hallucination. So which are the features? We have anhedonia, we have decreased appetite, we may have the altered perception, but there is definitely decline in the normal focus on concentration and optimistic thought. In the depression, we usually have a pessimistic thought. That's why we have C also, because in this severe depression, I may have a disorders of perception where I am hearing a voices who is telling me derogatory comment upon myself or giving a negative remark on myself, or they tell me that you are a bad man or something like that. So basically they are the features all of a depression. So even the altered perception should be labeled here. So A and B and C. That is a feature of a severe depression. Here I must tell you, the point they are touching upon is too much is a atypical depression. We all know the features of typical depression. They often talk about in the INI-CET, they definitely would ask about the atypical depression, where is a reverse happen. D is for sure. देखो डॉक्टर साहब जगह है, देखिए डिप्रेशन, what in English we call, in psychiatry we call it as a major depressive disorder. D भी डिप्रेशन सिम्टम नहीं है, because what is depression? It's a sadness of mood, lack of interest, lethargy. Three main cardinal features. Then we have the hallmark: poor attention and concentration and poor focus, decreased appetite, weight loss, decreased libido, decreased sleep. Classically we have a early morning awakening, हर समय रोने का मन करता है, क्राइंग स्पेल्स, बहुत पाप करा मैंने, पापी हूँ मैं, एक्सेसिव गिल्ट वी हैव, पैसिमिस्टिक व्यू ऑफ फ्यूचर, इससे अच्छा तो फिर क्या होता है, आइडियाज ऑफ hopelessness, helplessness and worthlessness. Then we have the death wishes, suicidal ideas or suicidal attempt. We know, sorry doctor, I gone into detail. We have mild, moderate and severe depressive disorder. Mild is 2 plus 3 for 14 days. Moderate is 2 plus 4 for 14 days. I hope you understand. Any two of this, any three of this for 14 days is major depressive disorder, mild. 2 of this, 4 of this for 14 days is a moderate, and anything more than 2 plus 4 will be called as the severe depression. It is of two types: without psychotic symptom, with psychotic symptom. साइकोटिक सिम्टम क्या क्या होते हैं डॉक्टर साहब? कानों में आवाजें आ रही हैं, चलो चलो आ जाओ, बहुत हो गया, आत्महत्या कर लो, आओ ऊपर आ जाओ. That is why I say altered perception also is seen in the depression. I may have a nihilistic delusion. I am ending, my intestines have been rotten up, kidneys have been damaged, brain is no there, mind is no there, अतड़ियाँ गल गई, सब लुट गया, बर्बाद हो गया. It's a Cotard syndrome. Or I may have a delusion of guilt or delusion of sin. पापी हूँ मैं, बहुत पाप करा मैंने. That's a detailed understanding of the major depressive disorder, mild, moderate and the severe. That's a typical depressive episode. ठीक है डॉक्टर साहब. Now we could be asked about the atypical depression, where it is a ulta, where there is a increased sleep and lethargy. There it was a decreased sleep, increased appetite, weight gain obviously, weight gain. We have the reactivity of the mood in the atypical depression. See here it is a mood is persistently, pervasively sad for 14 days. हर समय हर जगह मेरा मन उदास रहता है. That is what is the real depression. Whereas here it's a reactivity of the mood. There is a leaden paralysis. Body is heavy like a lead. Body is heavy like a lead. And there is a rejection sensitivity. Patient will say, "That's up. My hands become so heavy. How can I take food?" and so on. And it's a rejection sensitivity. They're extremely sensitive to rejection. Drug of choice of this is the MAO inhibitor. But we prefer SSRI over TCA. MAO inhibitor, we know they can lead to cheese reaction. They inhibit the metabolism of the SSRI. They inhibit the metabolism of the SSRI. So basically, we don't give them. This is a question in the NEMANS this time. The questions are linked. So MAO inhibitor, they lead to the cheese reaction, the hypertensive crisis. So if you remember the NEMANS this time, they asked you a simple question. SSRI is avoided to be prescribed along with the phenelgine, which may fear of a serotonin syndrome. Toxicity may happen because the MAO inhibitor will stop its metabolism, leading to the hypertensive crisis and the cheese reaction, or that's what. So we prefer the SSRI over the TCA. So a tricky MCQ of INI exam I just share with you. Sorry, I couldn't make a slide of it. It's an interesting one. Significant weight loss in depression is very naughty MCQ of NEMANS, AIMS, PGI and JIPMER. The moment we see this question, our mind will go to the PSM book, HIV TB topic. Please help me with the answer. A, B, C, D. Naughty NEMANS, naughty AIMS, they asked you this question. Significant weight loss or weight gain in depression. Because sometime in the INI PGI they ask you that depression we have both. In fact, the DSM-5 has been categorically saying we have both weight loss or weight gain, increase sleep or decrease sleep. बताइए डॉक्टर साहब, A, B, C, D. 12 लोग हैं हमारे पास, 12 जवाब आना चाहिए. संजय नैन जी, किशोर जी, डॉक्टर खान साहब, बताइए. It's a tricky, naughty MCQ. Very good, Dr. Saab. It is D. Very well done, Dr. Kishore. So it's a tricky MCQ. In the depression, the weight loss or weight gain is the more than 5% in 1 month. Okay. So that's all about the Yes, it is D. Now, this we all know, the Narcotic Drug Act. Always been a love of the every exam. And we know the drug not included is the alcohol. The NDPSA does not talk about, it's silent about the alcohol. It talk about the opium, heroin, morphine, cannabis, alcohol, hemp, but not about the alcohol. ठीक है डॉक्टर साहब. So now we have the disorders of movements include. Disorders of movements are include. We know mannerism, waxy flexibility, stereotypy movement, and autism is also a disorder of the motor movement. It's a repetitive, pervasive movements are there. So disorders of motor movement are the all except the delusion. So it is the E. Include waxy flexibility, stereotypy, mannerism, ABD. Mannerism is movement, Dr. Sahab. Mannerism is also a disorder of movement. किशोर साहब CV है. Okay. देखिए. So we have stereotypy, we have mannerism, we have perseveration. So you can join us for the special class on the Unacademy app, which is a repetitive, non-goal directed movement. Okay. Child doing this. Mannerism is a style of a person. I do this, I do this, I take my care of my emotion. It's a repetitive, goal directed movement. In fact, we have an MCQ that mannerism differs from stereotypy in being goal directed. Perseveration is a repetition beyond point of relevance in response to stimulus. You ask me, what is your name? I tell you, my name is Mahesh. You know, if I told you one time my name is Mahesh, you would have understood my name is Mahesh, but I keep on telling you like that. You ask me what is your name? I tell you Mahesh. What is your father name? Mahesh. Where do you live? Mahesh. Which country you belong? Mahesh. So they are all example of a perseveration. So in fact, we had an MCQ that perseveration differs from mannerism and stereotypy in being always in response to stimulus. See, child do this, I do this spontaneously. But I tell you Mahesh only when you ask my name. So I think that's all for today, because we have a 10:30 we have a ritual of special class where today we are learning the dissociative disorder, grief, eating disorder as per the current line of this. The easy way to download the Unacademy app is very simple. You can, you can have it at these are all the MCQs we will discuss in some short class. We have gone miss. So yeah, this is a way you can download the Unacademy app. Just go to the Play Store and download Unacademy Learning app. Choose the option plus subscription for NEET PG, or you can choose the INI-CET subscription. And 12-month is around 4,125 per month. If you apply the NEET code, or you can apply my code of Dr. Sandeep-YT, you will get a discount of 10%. So please join us at the Unacademy platform by downloading the learning app and enjoy the first class of the psychiatry. Hope you enjoyed this YouTube session, and thank you so much for joining with us in such a large number. And please, we will have YouTube regularly on Tuesdays, and every Tuesday and Friday we have the 4 p.m. we have a psychiatry quiz for 10 minutes where we discuss the 20 question live with me. So thank you so much. Good night. See you at the Unacademy platform on the class of special class and the plus courses. Enjoy learning. Make it simple from comfort of your home at the platform of